Dr. Elizabeth Barrett. I'm a general, minimally invasive, and bariatric surgeon with HCA's Advanced Surgical Partners of Virginia. I became interested in general surgery because of the ability to take care of a patient throughout their entire course of illness, from admission to all forms of their therapy, medical therapy, operative therapy, and then post-operative management. My interest in bariatric surgery was coupled with that desire to help patients and also help provide counseling and lifestyle guidance, and as well as helping people live a healthier and more active life. So general surgery involves taking care of a wide variety of issues: gallbladders, hernias, bowel obstruction. However, my primary focus is weight loss surgery and treating obesity with surgical therapy. So the commonly used definition of obesity is being approximately 100 pounds overweight, or we use the body mass index, or BMI, which is a ratio of your height in meters to your weight in kilograms. And when we're talking about BMI, we talk about ideal body weight being between about 18 and 25, overweight between 25 and 30. We start using the word obese at a BMI of 30, and then we talk about severe obesity between 35 and 40, and then we start using the word morbid obesity at around a BMI of 40. And morbid obesity means obesity that is causing medical problems. There are many factors that contribute to obesity. Certainly our genes and our family history play a major role. However, our diet and our activity level are also very important in controlling our weight. So truly it's the interplay of our genes, our diet, and our exercise that will contribute to our weight and ultimately can contribute to obesity over time. Obesity is certainly on the rise worldwide, and particularly in the United States. We now have more than 2/3 of our population is overweight, and the proportion of obesity is increasing, particularly in certain groups such as women and children. Obesity is more prevalent in women than in men, and some of that is linked to the fact that women, by definition, have a little bit more fat storage to help with childbearing. Women have some different struggles when it comes to weight because as we go through our phases of life, many of us go through pregnancy and childbirth and then nursing and then maybe multiple pregnancies, and there's a lot of variations in our weight and our health that go along with them. And that's a unique challenge for women because we do undergo maybe 30, 40, 50, even 80-pound weight swings as we go through some of these major life events. These weight swings can be hard to control with just diet and exercise, especially if you're a new mother with a baby trying to exercise and watch your weight as well as you can. This can be a time that is a very challenging time for women. Unfortunately, many women are still identifying their self-worth with their weight, and we struggle a lot with our self-image when we struggle with our weight. In addition, often women are the primary caregivers in a family, either for very young children, school-age children, or either older children or their other family members. This can often make it that they are having a hard time making time for themselves, making time to do exercise, or even to meal plan for ideally healthy meals. Many working women have a hard time struggling with the balances of a career and family life, as well as taking care of their health in an optimal fashion. There are several factors that are very important before undertaking weight loss surgery, but the first and foremost among them is the willingness to undergo a significant lifestyle change, to change your diet, your exercise routine, and to undergo surgery to help change your anatomy that will support that lifestyle change.